Very good afternoon, everyone, and I'm very grateful to AIOS for having given me this opportunity to speak about OSCAR. Now, slides. OSCAR, be it on the entertainment front or in the educative field, it's the ultimate. Now, we have 7 competencies which are much spoken about in the field of ophthalmology: the medical knowledge, the patient care, practice-based learning, interpersonal and communication skills, professionalism, systems-based practice, and last but not all the least is the 7th area of competence, the surgery, that was subsequently included. In fact, all of us do know that we teach and assess the skills of ophthalmology residents, and the most important attribute which is directly related to the patient outcome is the surgery. That's the 7th competency that was subsequently included. Now, learning how to perform surgeries can be definitely one of the daunting tasks, and that we all have gone through. We all have been taught. We also teach our residents, and then we also probably help them to ascend in the scale of being a novice, being a beginner, advanced beginner, competent, and an expert. Now, we all know that exit exams only test the cognitive knowledge of a postgraduate student, and the degree would be awarded based on the performance in the exit exams. But surgical skills definitely are not formally assessed, and they do not form a prerequisite to exit residency. So assessment of surgical skills definitely is a need of the hour. Now, why do we need assessment? That's because it is dependent both on the psychomotor as well as the cognitive proficiency. Now, they have to master the cognitive knowledge and do apply them in their professional career wherever they start after the completion of residency. Now, institutions definitely may stress on the quantity, but the quality definitely may differ. And surgical educators definitely have expressed concern that their residents may lack confidence and competence after the graduation, and many of them may not continue to go for a fellowship and may start from their private practice soon after the completion of the residency. So definitely assessment of the surgical skills will provide an insight to the teachers now how well or how efficiently you can make a resident develop into a good surgeon. Now, do we only do assess or teach? No, both of them definitely go hand in hand. It's something called as we teach to assess and then we assess to teach. Now, it could be either in the form of a summative assessment or a formative assessment, whereas summative is at the generally, probably we take it similar to that of a university exams, or a formative assessment is done in the middle so that we know at this particular stage the resident needs to put more effort or needs to put more interest into whatever it is being done. Now, what are the principles of assessment? Time, it is valuable, limited, and then you are testing the application of the knowledge and skills rather than just facts. And more important is that particular situation. So if you're assessing the postgraduate on that particular day, because you cannot conclude and say that she has been doing well from the past probably 6 months and today she's not able to perform. On that day, whatever or the situation specific, the performance has to be assessed. And define assessments clearly in advance. Tell the students that we'll be assessing your surgeries today, or probably we'll just monitor how you're performing the surgery today. Now, we have been doing this definitely, even though there is no structured way. We definitely teach, we definitely assess the skills of the residents. But there is something called a rubric, which helps us to do it in a structured way. Uniformity and standard decreases the subjectivity of the assessment. That is, even different evaluators can use the same rubric and assess the skill of the residents. And defines for the assessor also. So the assessor also would know what behavior of the student is to be assessed or what step of the resident is to be assessed. Now, what are the tools that are available? There are many different tools that are available, like OSS, which was the first one, which objectively assessed the surgical skill competency. And OSACs and HRACS, and some of them definitely saw the videos of the residents, the surgeries of the residents being performed, and then they graded. But we in our institute used the AIOCMTC2, that is the International Council of Ophthalmology, objective structured assessment of the rubric, and then we brought out an interesting study that we assess the skills, or we assess the particular steps of the residents, and then we evaluated them. We gave the number, and we also asked the residents to grade their own surgery, and we tried to compare the two results and tell them at what particular step they needed little bit of improvement. Now this is something known as OSS. This is GRASIS. I'll just go into the details of OSCAR. This is HRACS. The next one is making of OSCAR. Now what is this? It is Ophthalmology Surgical Competency Assessment Rubric. Now how was it done? So the 15 international ophthalmologists used something called as the Dreyfus model of skill acquisition, wherein they again went through the document of OSACs, and then they modified it, and then applied this concept of Dreyfus model of skill acquisition, and then for each level they started giving marks, and then for globally acceptable rubric was done. Now this was approved by International Council of Ophthalmology as an assessment tool, and then face and content validity was also established. Now if we type AIOCMTC2, we have rubrics for all types of surgeries, including ECC, SICS, phaco, squint surgeries, trabeculectomies, and also for pan-retinal photocoagulation and other procedures that is done. Now how does this look? So this is how the AIOCMTC2 tools look if we search in the website. There are different tools available for different types of surgeries. Now what did we do here? Here, in each chart, each step will be written. And for each step, we have 5 different levels. That is the novice, the early beginner, the advanced beginner, the competent, and the expert. Now each will be given marking, 0, 1, 2, 3, 4. Now the resident after the surgery has to simply circle. Probably today, the resident was not able to maintain tissues properly, in the sense excessive handling of tissues. So it has an explanation when if it is an excessive handling, you will have to give a number for the same. So the resident would take a copy, that's what we did, take a copy of the printout and then circle whichever category on that day the surgery was being done. It has to simply be circled. At the end of the case, it has to be completed. And then we as faculty immediately gave the feedback after that particular case. So then we tried to compare the results of the faculty as well as the resident. Now if different people are doing, then we had a consensus that initially only we saw the printout, and then we said this particular step, this is the way it would be assessed. So all of us came into a single consensus. Now this is the ICO rubric. There are different indices, global indices also, which gives importance to the tissue handling. Now how did we use OSCAR? So it was monitored, and when we gave her we initially gave the printout, we made her to read the printout and then discussed about it, and then after the surgery she was made to give points to her surgery, and then we evaluated. Now the important thing, there was a scope for self-evaluation, there was a comparison between the trainee and the trainer, we repeatedly administered the rubric, and we also got feedback from the residents. Now the results showed that there was a significant difference between the first case and the last case. And especially this difference was very significant in the second year students, because initially they were not exposed to much surgeries. But the difference was not much in the final year, because already they were doing surgeries, so they improved marginally. And the faculty feedback also had a similar results when compared to that of the student results. Now the feedback was, yes, it definitely helps us both as an assessment tool and as well as a teaching tool. Now conclusions, the rubric definitely gives us what patterns of behavior are expected in a resident, and therefore we can follow it up, we can evaluate and help them to become a good expert in their surgical career. Now OSCAR is preferred because...
Adjust to the time. Yes. That is very important. Thank you.
Thank you very much. Excellent presentation.